Hey, Margie here. Strong, healthy bones require good quality sleep. And unfortunately, so many of us are not getting a good night's sleep. Well, hopefully that will change after this interview because we're going to delve into this topic with our very special guest, Dr. Audrey Wells. And Dr. Wells is a seasoned sleep medicine physician and professional mindset coach. She's on a mission to help people get the most out of their sleep, live with vitality, and protect their long-term health. Through SuperSleepMD.com, she offers a comprehensive library of self-directed courses, a group coaching program, as well as she does individual coaching for those who want to uplevel their productivity and potential by taking too tired out of the equation. Because we know good sleep changes everything, your bones, your happiness, your overall health. And in this interview today, it's full of action steps and so much information that really can change your life. So stay tuned. Welcome, Dr. Wells. I'm so excited to be back with you and to share this information with everyone because this is life-changing and this is not something we can take lightly. We must deal with it. This is sort of a non-negotiable that a lot of people just don't think is important. So welcome.
Thank you so much, Margie. It's so great to be here and just kind of elevate sleep into the conversation of health.
I just have to tell you, ever since you gave the class to my community, I have gotten so much, people thanking me, and this has been so helpful. And, really what you taught was really life-changing. And I've just been getting so many, just people are so grateful that we brought this into the conversation. So I'm really excited that we're going to even bring it to a larger community because this is so important. But before we start, since this is Happy Bones, Happy Life, why don't you tell us why poor sleep has negative effects on our bones? And, just let's start with the bones. Like, what does it do to our bones that we need to really pay attention and, make changes if we are not sleeping, we're not getting adequate sleep?
Yeah, and I want to start by saying that, bones and bone health is definitely important. But when you talk about short sleep, sleep deprivation, or dealing with an undiagnosed sleep disorder, or if you have something that's diagnosed but not treated, there's a common pathway that happens when you think about the effects of too little sleep or bad sleep quality, and that's inflammation. So as you know, where you're talking about bone health, there's this balance between osteoclasts and osteoblasts, the bone building and the bone remodeling, and sleep deprivation and untreated sleep disorders disrupts that balance and creates an inflammatory environment that is going to accelerate bone loss or prevent new bone from forming if you're trying to do weight-bearing exercise and that. So it's really remarkable because just a simple thing of paying attention to your sleep, making sure you're getting enough, and making sure that's good quality sleep can really have a hand at your back when you talk about improving your bone health.
Yeah. And the thing is, a lot of people, will worry so much. Are they eating the right food? Are they getting the right exercise? And somehow as a society, what I've found is people just accept that, oh, I'm getting older. No one really sleeps well. None of my friends sleep well. And they just sort of accept that that's the status quo. Or maybe I'll just take a sleeping pill, which we'll get into. But people don't realize, and that's why I love what you do, that there's so much that can be done. And this is important, that this not only will change your bones, but your overall health. Do you want to talk about the other areas? I mean, your heart and your metabolism and other areas briefly that and that's sort of what I always tell people, a diagnosis of osteoporosis is, it sort of is an opportunity to change things in your life because when you do things that are good for your bones, everything improves. But when you change your sleep, that's really true. Everything improves. Do you want to just shed a little light on that?
Totally. I think to be healthy human beings, there's kind of three metrics that we look at. We look at what you eat, how you move, and how you sleep. So it's like a three-legged stool. And I'll admit I'm a little biased because I think that sleep is actually the foundation for better eating and better exercise habits. And I'll just invite you to think about like the last time you didn't get enough sleep. Maybe you had an early flight, or maybe you were up for several hours in the middle of the night. The effect of the way you think the next day, how motivated you are, your food choices, even whether you exercise or not, are all influenced by how good or how bad our sleep is. And so when you think about, every night of sleep as an opportunity to bolster up those good decisions about how you exercise and what food choices and how much you eat, you're really sort of building a momentum for the rest of your life. And I really like this quote by James Clear, because, people get into this idea that it has to be perfect, or, it's all good, all or nothing mentality. But really, James Clear said that it's like you're giving yourself a vote. And at the end of the day, you can choose to vote for good sleep, or you can stay up doom scrolling for several hours. That's so common nowadays. So you want to just accumulate those votes for good sleep night after night. And that really sets the stage for your long-term health goals and even your mental health.
Yeah, that's so wonderful. And I teach a happiness program, and I know there is such a huge correlation with happiness and mindset and sleep. A night, miss a night of sleep, it tremendously affects your next day in so many ways. So that's
Totally.
yeah.
And I'll answer the second part of your question, which is how does negative sleep or bad sleep impact a person's health? And to your point, people often discount their sleep. They feel like it's negotiable, or if there's stressful things going on in life, the sleep gets pinched as they're trying to accomplish things. But the problem is that it's dangerous, and it's dangerous in a couple of ways. So there's this short-term danger in the form of drowsy driving or doing anything that requires vigilance. You can have a job. I had an electrician once tell me that not only was he working with live wires sometimes, but he was also working at heights. And I thought, oh my goodness, that's somebody that's really having to have a lot of vigilance in their day, which equates to safety. So most people drive. Driving sleepy is a big no-no, but even when you're sleepy, you don't necessarily perceive how sleepy you are. And there was a big study done, gosh, I think it's a decade old now, showing the effects of one night of sleep loss on driving. And it was about the equivalent of driving under the influence of alcohol to the point of being intoxicated. And, that's kind of an extreme, but suffice to say that if someone is chronically sleep deprived, it is the equivalent of having a non-zero alcohol amount in your bloodstream. So, you're really putting yourself and others at risk if this is a chronic situation. And then looking out further, I want to make the case that if you don't sleep well, it increases your risk for heart disease. It increases your risk for neurologic disease. It increases your risk for cancer. These are the major killers in the United States. These are on the top 10. And, when you think about, just how time kind of slips through your hands, the time to act is now, and establish that habit of healthy sleep. That's going to serve you not only in your day-to-day life, but it can actually define the way you spend the last 10 years of your life.
Oh, I love that. And it was so interesting when you came to my class, because I always teach all the basic things, the darkness and things we'll touch on today too. But there's a much deeper side to this. And so many people just accepted, no, that's me. I don't have sleep. But you really, I learned so much from you that there are, there's there are treatments for this and there are things that can be done, and it's not hopeless at all. So I'm really excited 'cause we're going to talk about some of those things. But I think something interesting is people don't realize that women sleep a little different than men. I thought that was interesting. You want to talk about that?
Yeah, definitely. And I approach this question with a lot of humility because the the field of sleep medicine is still a young field. So we are constantly learning and trying to make sense of what we learn. I think that where women's sleep is concerned, there's even a delay because women were not involved in clinical research studies until the 1990s. So we are looking at relatively less data on women's sleep. And, it's a problem because men and women don't even report symptoms differently, much less, experience sleep differently. And an analogy is, for a long time, symptoms of heart attack were like, you have to look out for the crushing chest pain that radiates into your left arm or up your neck. And so people were kind of on the lookout. They knew to go to the emergency room right away, chew an aspirin, all that. And then later, it was found that all of these women's heart attacks were being missed because a woman's heart attack looks different. You can experience indigestion. The pain is more subtle. There's just a different presentation. The same is true for the disorder of sleep apnea. A woman looks more like, I have trouble getting to sleep. I can't stay asleep as long as I want to. I'm tired during the day, not necessarily sleepy, but tired. Whereas a man will report loud snoring, pauses in breathing during sleep, and daytime sleepiness, nodding off in meetings and at movies and such. So what I like to sort of point out is that if we take sleep apnea, for example, this is a massively underdiagnosed condition. It's estimated that 80% of people who have sleep apnea are not yet diagnosed. And if you just isolate women, it's 90%. 90% of women with sleep apnea are undiagnosed because their symptoms look different. They don't necessarily snore, or their bed partner doesn't notice it. They don't necessarily have these dramatic pauses in breathing with choking afterwards. So when I have a woman who's a patient of mine, I look at her with a much more nuanced lens compared to a man, just because I know she is not necessarily going to present like the poster child of sleep apnea.
Let's dig into sleep apnea a little more because I was astounded by your statistics when you had said the percent. You want to just share the statistics, the percent of people who actually have sleep apnea?
Yeah. So if you look at adults, about 1 in 3 adult men will have some degree of sleep apnea, mild, moderate, severe. When you look at women, premenopausal women, 1 in 5 will have some degree of sleep apnea. And after menopause, the incidence and the prevalence is equivalent to that of men. So menopause, that transition puts you at risk for sleep disordered breathing, such as sleep apnea.
Yeah, it's just incredible. I think that's such a huge number. I had no idea it was that large. And as you said, the majority are missed. So there are people listening. I'm sure I can't imagine who's going to write back to, oh my gosh, I found that I had sleep apnea. And that's good news because there's treatment for it. So you want to go on how people can figure out if they have sleep apnea because, as you mentioned before, sometimes the home tests aren't really giving enough information for everybody. So why don't you just go into that? Because I really want to give everyone information and tools that after this, if this sounds like them, they will take the next steps because why should they put their health, their bones, everything at risk just because sleep apnea was missed?
Yeah, I think it's really important to bring up the idea that you are unconscious when you're asleep. So you have this blind spot in your experience. And because of that, For a woman who has any kind of symptoms, daytime tiredness, irritability, weight gain, problems with foggy brain or fuzzy memory, word finding difficulty, diabetes, heart disease, these are all things that could be risk factors for sleep apnea or something that sleep apnea would worsen if it's not treated. So nowadays, with health insurance, and especially since the pandemic, home sleep apnea testing is typically the first measure to figure out if there's a problem. And I want to preface this by saying that a home sleep apnea test, number one, does not test your sleep. It has an estimation of sleep, but it's not a sleep test. It's a sleep apnea test. Number two, it's not perfect. So if you have a home sleep apnea test that comes back negative, but you're still symptomatic, I would rather call that inconclusive, and you may need a deeper look to make a diagnosis. And number three, especially for women, a home sleep apnea test has a tendency to underestimate the severity of obstructive sleep apnea. And so with that in mind, as a woman is looking at treatment options, they may elect to kind of have that caveat and choose something that's a little bit more robust. I have a home sleep apnea test here that I want to show the audience because, one of the fears with getting tested for sleep apnea is that the test is not going to capture a representative night's sleep. And I want to reassure everybody that, the test is made to look at parameters that are problematic, and it's not necessary to kind of have that perfect night's sleep. But I would say that if you follow your usual routine, take the test, don't think too much of it, then we're likely to get a good study. So this is one type of test. This is a very common type. This is called the WatchPat-1 device. And this device uses pulse arterial tomography, which is a very sophisticated technology where it's looking at the vascular response when you're having a breathing problem. So there's a special finger probe that just slips over your finger, and there's a little bit of pressure in there on my finger. Not uncomfortable at all, but this test is measuring that pressure differential. It has a little watch-like device on the wrist. And then this is a position and sound sensor that gets snaked up through your pajama top, and it just sits on the lower part of your neck right here. So pretty unintrusive, don't you think? It's not too much. Yeah. So this test is a reasonable starting place. But again, anybody who has symptoms, who's excessively tired or sleepy, or has medical conditions that are concerning, even with a negative test, I would help that person move forward with a deeper look at their sleep.
So what you're saying is if this is positive, that's good enough to move to the next step in terms of treatment. If this is negative, if you still have symptoms, move on and get the other kind of sleep test.
Yeah, you're exactly right. And another way to kind of think about that is the home sleep apnea test is only helpful if it is positive in someone with symptoms. If you're somebody who really is just having insomnia or can't stay asleep for a long time, this may not be the first test. You may need to go for an in-lab sleep study. That's also called an attended sleep study. And that really should be done at an accredited sleep lab, which you can find locations near you at sleepeducation.org.
Oh, that's great. And you also have an incredible handout, I think, that you're being so kind to offer to everybody on really going more into detail on who needs a sleep apnea test, correct?
Right. Yeah. I mean, I think that's a question that's on a lot of people's minds is like, okay, maybe, I don't know, is it time for a sleep study? And I'm happy to share the link to get this handout with your audience. And it will kind of walk you through who should have a test and why. And then I have specific information on home sleep apnea tests and in-lab sleep studies.
Oh, great. So we'll have that in the show notes. And I've seen this handout. It's fantastic. It just, really, really gives you the resources that you need, and, it helps you figure out your next step. So I think so thank you for sharing that. Okay. So let's talk about someone does have sleep apnea. What are the next steps? What are their options? Because a lot of people freak out. They just think of this massive machine and, oh, I just can't do that. Or their husband has it. There's no way I'm going on this. So why don't you just share what are some of the options for people?
I think I have been in practice long enough. I've heard it all. And one of the common fears is that if I take a home sleep apnea test, then there's going to be a CPAP machine waiting for me, and it's going to be horrible because there's the mask and I can't do that. And like, it becomes a lot of things to consider. But I really want to say to anybody who's on the fence that you are always in the driver's seat. The test simply helps us get information so that you're not sticking your head in the sand and saying, like, if I don't test, then I don't have it. So once you have information and knowledge about how sleep apnea can affect you personally, you can make an informed decision about what to do next. And it's never my intention to say that CPAP is for everybody. That's not my mission in life. I would like to match people with the treatment that works. But the truth is, CPAP, or continuous positive airway pressure, is the gold standard treatment because one of the features of obstructive sleep apnea is it's a multi-level obstruction, meaning you can have airway obstruction anywhere from the back of your nasal cavity all the way down to below your tongue. And so the CPAP, that air pressure, holds your soft airway tissues open so that you can breathe during the night. Now, I've brought some examples of masks. Would you like to see those, Margie?
Oh, absolutely. I think that would be great.
So when people talk about CPAP, they often make this motion of, the hand all over the face. And I want to show you a couple of examples because, claustrophobia is an issue. And if you have untreated sleep apnea, you tend to be more claustrophobic. Why? Because you're vulnerable during sleep. You're experiencing that airway collapse during sleep. So treatment may help your claustrophobia. And I want to show you a very small mask. So this is a very new mask that's out from Fisher and Paykel. This is called the Solo mask. And you can see that it just goes up to the nose. And then there's some headgear straps here and a covered cloth strap across the cheek. And these just hold the mask in place so that air pressure, which comes from the machine, is delivered through the tubing, through the nose, and into the soft airway, which is prone to collapse during sleep. So this is called the Fisher and Paykel Solo mask, and there's different brands, different styles, but this is one of the slimmer designs. Now, you would necessarily have to breathe through your nose with this mask because if you were to open your mouth, the air pressure would just take the path of least resistance and come out of your mouth, which is no fun. So I really endorse nasal breathing, but for people who can't, this is an option that might work for them. So you can see this mask also comes up to the base of the nose here, but it covers the mouth so that you can have the option to breathe through your nose or through your mouth, and the air pressure is delivered again into the back of the airway to support the airway in an open position. And one of the things that's a little different about this mask is that the tubing from the machine inserts on the top here, so that if you're lying in bed, you can move from side to side, toss and turn however you like, and the tubing doesn't go flopping around. So there are different combinations of these, but this is one of the smaller oral nasal masks. There's also masks that go just over the nose, and all different shapes and sizes for breathing. You need to breathe well during sleep.
Wow, it really is very different than some of the, pictures that you're accustomed to. in terms that are so scary, as you mentioned?
I want to say I've used all of these masks. I have sleep apnea. It's rather mild right now, but one of the ways that I walk in my patient's shoes is I try all of the masks out there. And I can tell you that, yeah, there's an acclimation period, but for anybody who questions whether they would be able to do it, I can say with a great deal of confidence, yes, you can. It's a mindset. But once you get into that mode of protecting your sleep, protecting your breathing, protecting your health, it becomes a lot easier.
And you've been doing this for 2 decades. You've been working with people. And what have you seen when so they find out they have sleep apnea, they go on the machine. How soon do they start noticing results?
A very small number of people will have benefit from night one, and they will take to it like a duck in water. And, I those are the lucky ones, to be honest, but it doesn't happen for everybody. In fact, I would say a more common scenario is that somebody's trying it and kind of having some stumbles in the beginning. But if you stick with it, if you show up every night and put the mask on, then things start to get easier, usually within a couple weeks or so. And then there's a group who takes longer, especially if their use is sporadic or they have a lot of mental drama as they're just lying there in bed, hating everything. Those folks tend to have a harder road. And part of my mission with SuperSleepMD is to give folks support and knowledge right in those beginning weeks so that they can have an easier experience and go on to either choose CPAP for the long term or potentially go with another treatment alternative, such as a surgery or an oral appliance.
That for people listening on, people are just listening. You'll be able to see all of this on YouTube or, so if you're just listening and you're not viewing it, Dr. Wells is showing pictures and illustrations. So it's on YouTube, and also you can look at it on my website where my podcast is too, just margiebissinger.com and hit podcast. So just in case the people who are, on Apple Podcasts or just listening, you can view these later on. You want to talk about the other alternatives?
Yeah, definitely. In fact, one of my show and tell items is an oral appliance for sleep apnea. So this is a nylon appliance. It's white, it's very slim, and it's custom made. So this is the difference between a medical grade oral appliance and sort of the boil and blight kind of thing that you can buy over the counter. So these are custom made by dentists. And the way that they work is that there's a piece that fits over the upper teeth and a piece that fits on the lower teeth. And on this one, these blue bands engage on the side to pull the jaw forward, which helps to open up the airway caliber during sleep. And for many people with obstructive sleep apnea, that forward movement of the jaw can be enough for normal breathing, normal oxygenation, normal sleep. I do really put a plug in for an experienced and savvy dentist. I'll give you another website resource here so that if people are interested, they can go to AADSM, the American Academy of Dental Sleep Medicine.com. And similar to sleepeducation.org, you'll enter your zip code and find dentists near you who are certified in dental sleep medicine. Some people ask me, well, my own personal dentist said that they could make one. And I would encourage you to really do your homework because this is a medical expense. So you want your medical insurance to pay for it, not dental insurance. And the savvy dentist, the experienced dentist is going to know how to follow you through the course, make sure that you're not creating problems with your TMJ, problems with your teeth movement, problems with mouth breathing and such. So you need a higher level of dental expertise to make an oral appliance for sleep apnea.
Oh, so interesting. So do you recommend then before someone gets the CPAP that they get ruled out, they go to one of the dentists? I mean, is that like the step one before they would to check out their with the dentist first before they would actually get the CPAP?
No, I wouldn't suggest the oral appliance as first-line therapy for most people, just because CPAP is I can cure sleep apnea 95, 100% of the time. And you get it more quickly, and insurance pays very well, and you get to feeling better. But for people who can't use CPAP, I would say that the oral appliance made and customized by a dentist is the number one non-surgical treatment for obstructive sleep apnea. And you don't have to do either or, meaning you can still have an oral appliance made and have a CPAP machine. And sometimes people do that if they travel or they like to have an alternating experience or whatever. So they're not necessarily exclusive. But if you do have an oral appliance made, there's another step, which is very important, and that is to get a sleep test after you're acclimated to it to make sure it's working, because it doesn't always work. And you want to know that before you go on to use this thing every night.
Oh, wow. Such incredible information. And you just want to touch on the surgery as well?
Yeah, definitely. For me, I would say that most of the surgical treatments for obstructive sleep apnea fall in 3 buckets, okay? First one is Inspire therapy. Now, people probably know this because they have seen an advertisement, or they have a friend, or they've been to the Inspire website. What this is a hypoglossal nerve stimulator. So it's an implant. It goes into the upper right chest, because they leave the left chest for a pacemaker if you need one. So it's an implant. You can see it, the outline of it, if you were to have access under the collarbone here. And then there's some leads or wires that are sort of snaked up into the base of the tongue that go around the nerve that innervates the tongue. Now, the implant is activated by a little remote that is going to push your tongue forward as you breathe. It recognizes when you're breathing, and it pushes your tongue forward to get it out of the airway. Now, this is a very exciting surgical treatment for sleep apnea, but again, it doesn't work for everybody. And there's really quite a few criteria to identify candidates who are good for this surgery. I would also caution anybody who struggles with insomnia about getting this surgery. You really want your insomnia treated before you go down that route, because the Inspire device can actually aggravate your insomnia, and then you're worse off than when you started. There are a couple of new hypoglossal nerve stimulator surgeries in the pipeline, but for the time being, Inspire is the main one, and they're right here in Minnesota, where I live. So we get a lot of Inspire ads on the radio, and their marketing is very compelling, I can tell you.
Wow. Well, thanks so much. Is there anything else on that you wanted to say?
Yeah, I mean, I would say there's 2 other surgical treatments. One is called a uvulopalatal pharyngoplasty, or UPPP. There's a lot of different choices with this, and it's more modern than the past, where you only got like a 40% success rate. That's best done in the hands of an experienced ENT doc. And then I would say the third type of surgery is going to be something related to the nose, to improve nasal breathing, not necessarily to get rid of sleep apnea, but just to make breathing better and sleep apnea treatments easier and more comfortable to use.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com/osteoporosis exercises, or you can click the link in the show notes. Now back to the show. Well, you talked about we would ideally like to breathe through our nose, but there's so many people who are mouth breathers. And I know there are some, you have some things that you recommend. Do you want to talk about that?
Yeah, and I want to say that it's especially problematic during sleep because your jaw can relax and fall open, and then you're breathing through your mouth. So symptoms of that would be waking up with a dry mouth or having to drink water and then go to the bathroom in the middle of the night. But it's been shown that mouth breathing is associated with worse sleep quality. So mouth breathing alone, if you can correct that, can be related to your sleep quality. You could have better sleep quality with nasal breathing. I want to show you something that has been a little bit of a craze, I would say, over the past year or so, and that's mouth taping. This is a mouth tape that I've just tried last night, actually. It's called ZZZ tape. And this is medical grade tape meant for human skin. That's very important when you're thinking about having mouth tape on for the entirety of the night. And what it does is it literally goes over your mouth and it sticks there to not only support your jaw and your lips in a closed position, but make sure that you can breathe through your nose. For anyone trying this, here's my suggestion. Don't start with it at night. Do it during the daytime first to make sure you can tolerate it. Because if you can't, you certainly don't want to wake up trying to get the mouth tape off in a hurry. Is that something that you've experienced, Margie? I'm curious if you've tried mouth taping.
Well, it's interesting because just recently I thought to myself, I was waking up and my mouth was so dry. I'm thinking, I have to try the mouth tape. So no, I haven't tried it. And yes, I'm going to try it. So I will report back to people, but I'll get this brand. If you're liking this brand, you think it's a good one?
I do. Yeah. And, there's a lot of brands out there, but kind of, for people who just want to stick a big toe into mouth taping and see if they like the way the water feels, I would start with something over the counter at your local pharmacy. So, it's just any kind of bandage tape. It must be medical grade. It must be meant for human skin. But just taking a piece of it, putting it over your mouth during the day, you can even fold the corner over so that if you do start to get nervous or feel anxious, then you have a place where you can pull that off in a quick way. If you don't want to breathe with the mouth tape on, there may be some nasal obstruction that you need to address. Nasal saline is a great way to wash mucus out. But then you want to add a medicated spray if you've got congestion or a lot of swelling in your nose. And I have a couple of recommendations for that. So over the counter, you want to look for Nasacort spray or fluticasone nasal spray. These are topical steroid preparations that open up the nasal cavity so you can breathe better. And I found a spray that I really like recently called Allermi. That's Allermi. This is a custom prescription spray that has just a little bit of oxymetazoline in it. Oxymetazoline is Afrin, which is very potent, but you only want to use it for 3 nights. With Allermi, you can use it chronically, and that's the point. So I have noticed really a big effect with nasal openness when I'm using the Allermi, and I'm starting to recommend that routinely.
Oh, that's great. Okay, so now we've discussed sleep apnea, surgery. Let's go back to something really basic, because I learned something from when you came to my community that I was surprised about, because usually I thought, you want to wake up feeling great, but that's not how you assess, did you get a good quality sleep? That's what you taught me. You want to share that with everybody? Because I think this is interesting. Like how do you know if you slept well?
Yeah, I think a lot of people tend to make that decision about whether they slept well when they wake up in the morning, right? That first eye-opening, and you're like, okay, did I feel like I slept well or not? And what I would like to suggest is that you wait an hour after you wake up. and I'll tell you why. When you first get up in the morning, your cortisol levels are just starting to rise, and that's normal. Your body temperature is just starting to rise, and that's normal. And your circadian rhythm is coming online. That's a signal for awakeness. So all of these signals are ramping up. And for some people, they may not feel totally alert, not because they didn't have a great night of sleep, but because those signals are on the low side when they first open their eyes. So a better way to assess your sleep quality is to wait about an hour, uncaffeinated preferentially, and then say, okay, how do I feel now? And I think a lot of people have had that experience where, they wake up and they get moving, and maybe it's not so bad. Maybe they feel like it's okay.
That's very helpful because sometimes people will just wake up and they're thinking, that's crap sleep, and that's not the best time to evaluate it. And how many hours do you recommend? What's your standard recommendation?
So 7 to 8 hours for adults is where most people are going to fall. There's older sort of figures, and I have one myself in my educational materials that say 7 to 9 hours for adults. But I think if you're really at that 9 hour mark with your sleep requirement, you might start asking yourself if you have an untreated sleep disorder, which could be operating in the background, and your coping mechanism is extending your sleep time to deal with it. But it could be wreaking havoc on your health. So in general, 7 to 8 hours for most people. If you're getting less than 7 hours routinely, your brain is suffering.
It was interesting because after you came to my class, and I'll have this available for everyone because it was such a good session. You answered questions for around 45 minutes and people asked amazing questions. But people had asked, okay, so to make up, they felt that, okay, well, since I get up throughout the night, I'll sleep like 14 hours and that will make up for the amount of time that I'm not. But you want to just share that? Because I think that's important information. A lot of people think I'll sleep more. So then if I get up more, that will, that sort of made sense to them. But you explained that wasn't the best situation.
Yeah. And, I want to say that when your sleep kind of starts spinning out of control, it's really disheartening. You feel like you are supposed to have this biological attunement with your sleep. Sleep should come easy. Sleep should come naturally. So when it doesn't, people have a hard time with that because it affects how you feel and how you go through your day. And one of the coping mechanisms is to kind of spend more time in bed just in case you sleep more. But that actually ends up sabotaging your sleep unintentionally, of course. So the idea is if you're somebody who's going through a rough period with your sleep, and man, I've been there. I know what it's like when you're desperate to get some shut-eye. But staying in bed longer is going to be counterproductive. You actually want to do these things. Start by identifying a wake-up time and hold that wake-up time 7 days a week. That's something that you have control over. And so you want to hold that so your brain can now bookmark that wake-up time for efficiency. Then you want to walk back and decide what time you're going to go to bed. You're not going to get into bed if you don't feel very sleepy. You want to stay out of the bed if you're not very sleepy or having a high chance of falling asleep. And sometimes it takes a little bit of sleep compression, meaning maybe you plan to get 6.5 or 7 hours of sleep in the short term so that when you get into bed, you're very sleepy, your sleep is quite deep, and then you have that wake-up time. And this reestablishes your trust in your sleep. So when things start to get better, still keep that same wake-up time, but start to go to bed a little bit earlier and a little bit earlier until you arrive at the sleep time that is appropriate for you. So sleep time is important, sleep quality is important, and sleep regularity. All of these metrics are important.
The first thing people think is, all right, you know what? I can't sleep. I'm going on sleeping pills. And, what would you, well, I think that's great. What you just said is amazing. But what do you tell these people? Because everyone's like, okay, I'll try L-tryptophan. I'll try melatonin. Let me try, there's all sorts of things they're bombarded with. And, people really don't know where to turn. And a lot of times, very often, the physicians will give people, sleeping pills. So what do you say to that?
It's so seductive to think I'm just gonna fix this by swallowing a pill, because you really want that reassurance that you're gonna sleep at night. And once you're at the point of considering pills, I think something's broken about your sleep. And so it's a very sexy idea to just get a prescription or to look for something over the counter. Um, I'm pretty conservative with sleeping pills overall, especially prescription sleep aids, but also sleep aids over the counter, because they're not very regulated and you never really know what's in the bottle. Case in point was a study of melatonin a couple years ago, and then maybe 8 years before that, they found things like serotonin in the melatonin preparation. They found CBD in the most recent study. So, these over-the-counter supplements can be contaminated, and they can also have a lot less or a lot more of what's on the label. So caution there. But with prescription sleep aids, my best advice is, if you decide that you want to talk to your doctor about a prescription sleep aid, have an exit plan from the start, because these are not medications that are meant to be taken for the long term in most cases. And just about everybody could benefit from shoring up their sleep habits in order to support their sleep once it's back on track. So never should a sleep aid be prescribed without all of the behavioral components that are going to support getting off of that sleep aid as soon as possible.
Such good advice. And I know we could talk forever, so I want to respect your time. But you brought some things that help people. Is that okay to show them? I know you have a couple other things that you have with you.
Yeah, definitely. I want to show you something that's kind of fun, because it's something that I do as my little habit every day, especially in the wintertime, because up here in Minnesota, I feel like we only get about 4 hours of daylight. And even then, the sun is very impotent behind the big cloudy sky. So these are some wakefulness glasses. You can see that there's blue light in my upper visual fields here. They don't have a lens or anything, but this blue light is a signal to be awake. So I put these on when I wake up in the morning and it's still dark outside. They shut off automatically after 20 minutes, and it just gives my brain this dose of light, which is a signal for wake. They're called AYO, AYO. They're rechargeable. It's super fun. And I actually felt so strongly about these that I'm now a retail partner for this company. You can find these glasses on my website.
Oh, that's great. So if someone can go out in the sun, that's great first thing in the morning. But if not, and there's a lot of places that if there isn't sun, or people who have jobs, they have to be at 6 a.m, that there's not an option to do that. So how fantastic is that? Oh, I love that.
Yeah, I like to say that your brain, being in the skull, is in the dark. So you have to tell it when it's light outside, and you do that with the windows to your brain, which are your eyes. This is a more economical option. This is a light box, and you can see how bright it is. This you can find on Amazon for 20 or 30 bucks. You want to look for something that's at least 10,000 lux. This one happens to be dimmable, and you can change the color to warm or bright. But it's a way to also give yourself a dose of light. You sit maybe 8-10 inches away. You don't have to look at it full on. But this is an option for people who want to have their breakfast and get their light exposure in as well.
How long would you look at that for? What do you recommend?
About 15-20 minutes, same amount of time. And, the important thing is how proximal it is to your eyes. So 18 inches to 2 feet is necessary. And it has this little kickstand here so that you can just put it on your table as you're sitting down.
Oh, that's great. Oh, these are so helpful. I've known people that use the light box, and these are people for seasonal depression. I mean, it's completely changed their life. It's amazing, something as simple as that. Wow.
Yeah, as human beings, we evolved to be very responsive to light. And so we can harness that and promote wake.
Oh, that's so great. Well, we could go on and on, but are there I want you to actually tell everybody because you are a resource. I also love that you work with people. You're not just, I have a website that you actually work one-on-one with people and you really help people figure out the root causes so that this doesn't become something that can truly destroy their life, their bones, everything else. So you want to just share what's available, what you do, as well as what courses you have on your website?
I'd be happy to. Yeah, so on my website, which is SuperSleepMD.com, I have a lot of free material in a free membership. You just enter in your email address, and it opens up all of these great resources, especially if you have sleep apnea or are worried that you have sleep apnea. I also host a private Facebook group for people with sleep apnea, and you can do a search on that to be accepted. I have a YouTube channel, and I have 4 courses that you can find on my website, both for people who have insomnia, sleep apnea, or both. I have also a work with me button on the website. You can access my calendar and make an appointment with me. And that is a paid appointment. Unfortunately, that's not something that I can scale. But a lot of people need this individual help because they have circumstances that are different, and searching Google just isn't doing the trick. So I have a 45-minute appointment where I look at your specific case and provide value so that you know what to do next to benefit your sleep or your life.
Oh, I love that. Well, I just can't thank you enough. Is there any else thing you want to share that we left out that that you think is important for people to know? And I'll also give them the link to the class you did with my community because that was just so full of valuable information. And as I said, I've gotten raves from people who came thanking me for introducing them to you. So thank you so much. Any last minute things you want to leave everybody with?
Margie, I really felt when I met you that our missions resonate. They're very in parallel with each other because what we're talking about here is living your best life. And I like to say that the well-slept version of you is the best version of you. So I'd really ask all of your listeners to just get yourself to a place where you are empowered to take control of your sleep because it's going to have a ripple effect throughout your entire life.
Oh, well, I can't thank you enough. And I so agree with that. So, Dr. Wells, when you came to my class, there were a few questions people asked. Number one, is sleep apnea more common if you're a back sleeper?
It certainly can be. That is the case for many people because what's happening when you're sleeping on your back is that the tongue can fall back with gravity and obstruct the airway. That being said, people ask me all the time, is there a better place, a better position to sleep in? And in my mind, you really want to have your back sleep available to you. That's also called supine sleep, because when you're sleeping on your side, you're putting pressure on your shoulders, hips, knees. You can have neck problems or lower back problems. And sleeping on your tummy is my least favorite position because of those spine issues and joint issues. So yes, you can have worse sleep apnea on your back or even isolated to your back, but you still want that position available, which may, push you forward to getting treatment.
Okay. So a lot of people asked about melatonin in terms of some people heard it's not good for your bones. Some people heard it's good for your bones. What is your feeling? Because a lot of times melatonin is prescribed to people.
Yeah, melatonin is not really a sleep aid. It's kind of a sleep timer hormone. And I want to first point out that your body, yours, mine, everybody's body makes melatonin. And what happens is if you're exposed to bright light in the evening, your own body's production of melatonin is suppressed. So, one powerful thing to do is reduce your light exposure in the evening so that your body can respond with that natural melatonin production. And that's going to promote getting to sleep and staying asleep. It's much better than any over the counter supplement you could find. And I think all of that points you in the direction of better bone health and better health overall.
Okay, and then some people ask about tart cherry juice, since there's been some research that that can help improve sleep. I know that also goes with melatonin. Do you have any thoughts on that?
Yeah, there's a lot of sort of single ingredients that have been studied. Tart cherry juice, kiwi, valerian root. And unfortunately, these studies are quite small and often industry sponsored. So there's a little bit of bias introduced with that. I think it's probably oversimplistic to think that there's one single food or one single anything that's going to be the answer to your sleep problems. So I wouldn't be able to tell somebody that that's beneficial. I also don't think there's a huge downside to trying it. And if it works for you, great.
Someone had asked about, I've never heard of this, Celian pillows. I don't even know how it's pronounced. Do you know anything about a certain pillow that helps?
I have not heard of that brand. I can tell you there's a lot of different pillows out there. And for me, it comes down to personal preference, neck support, spine support. So I would say that, if you're somebody who wants to try a brand of pillow, then just be prepared to kind of mark down what you liked or didn't like about it so that you're not having kind of this recall bias. It's a matter of choosing something that's going to be just right for you.
Yeah, and as a physical therapist, I'm such a big believer in, good posture while you sleep and something not forcing you into an uncomfortable posture. Exactly. Okay, someone else asked about the echo. They can put brown noise on from the echo in there. What's your thought about that? Using, brown noise or any of those kind of machines?
Yeah, this is all called sound conditioning, and it can be really helpful, particularly if there's noises in your environment that come out and disrupt your sleep. So, the idea behind all types of sound conditioning is to produce a relatively monotonous noise that your brain just sort of factors out, but it also deadens things like the snowplow coming at 3 o'clock in the morning or the neighbor's dog barking in the yard. So these are things that the sound conditioner is made for, but they can also be a signal for sleep if you're habituated to it. So I like it for that reason too.
Yeah, it's very interesting. I was staying in the city at my brother's apartment, which normally I don't sleep. I do not sleep because you hear everything. And so he had gotten one of these machines and it worked. It was amazing to me that I actually got a good night's sleep there, despite all of the noise that usually I just didn't hear it. So it's really great. Okay, two more quick questions. L-tryptophan, any thoughts on that? Because a lot of people talk about taking L-tryptophan helps with sleep.
Yeah, it can, and it's a precursor to melatonin. So L-tryptophan to serotonin to 5-HTP to melatonin. So I would say that that compared to melatonin is like 6 of one, half dozen of the other. And I would say, as long as you're not having a side effect or you're confident that the bottle has in it what is on the label, then it's fine to use for sleep.
Okay, and the last question, you had talked about brain dumps, which I thought was so brilliant because all the people who are waking up in the middle of the night with all these thoughts. And so the question is, does it matter what time of day? You may want to talk about what the brain dump is, but what time of day you do the brain dump? Can you do it right before bed, or is it better to do it earlier in the day?
Yeah, so a brain dump is basically evacuating your brain with all the thoughts that tend to bounce around in your head at night. And, in the middle of the night, we have a different sort of mind than we have at 9 o'clock in the morning, for example. So we tend to be more negative. We tend to catastrophize. We tend to ruminate. And this is a major reason why it's hard for people to get back to sleep in the middle of the night. So you can do a brain dump in the middle of the night if you find that your thoughts are just kind of active and you've got the monkey mind. Get up out of bed, go into a different room in low light, and just literally empty your brain out. I kind of liken it sometimes to, if you're going to clean out all the cabinets in your kitchen, you got to take everything out first in order to see what you've got, and then just put back the things that you need. And that can be very soothing to somebody who has a lot of monkey mind at night. You can also do it during the day, even if it's just to answer with your logical brain all of those fears and anxieties that tend to plague a person at night. Some people get a lot of mileage out of writing down their to-do list and just making sure they've captured all of the things that they want to do. So those are some ideas that are all side effect free and drug free. I really like recommending that white space.
Yeah, I think that was so great. And what about like right before bed, right before you go to sleep? Do you find that's a good time, or that might stir things up for people?
It can be a good time. It's something that you have to practice, because if you are a bit revved up after you dump out your brain, then it might not be the time for you. You can pull it back to sort of midday to see if that's better. But this is a very individualistic practice, and I think very well worth experimenting with.
Yeah, I love the idea of during the day. Most people don't think about that. That if you do that brain dump, then it won't occur. There's a chance that it could really make a big difference. And that's, you taught that to us before, which I thought was so great. Okay, well, thank you so much. This has been so helpful, and I just am so grateful that you are a resource for people, and that we can people can deal with this, because it will really be so life-changing.
Love it, Margie. Thank you so much.
Wow, I hope you enjoyed this interview with Dr. Wells as much as I did, and now have some new tools that you can put into your life to improve your sleep, your bones, your overall health. All the links that Dr. Wells talked about for all her courses and resources will be in the show notes, as well as the link to the class that she did with my community, which was really fabulous. It was 45 minutes of information, different than what she talked about here. And then 45 minutes, she answered really fabulous questions that people asked. So that will also be in the show notes. So thank you so much for tuning in. And I really hope you prioritize your sleep, because this is going to make such a big difference for your bones and overall health. And I look forward to seeing you on the next episode.